Introduction. Coronaviruses are a large family of viruses that are known to cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS, and severe acute respiratory syndrome, SARS. A novel coronavirus, COVID-19, was identified in 2019 in Wuhan, China. Coronavirus disease, COVID-19, is an infectious disease caused by a newly discovered coronavirus. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. COVID-19 is a disease caused by a new strain of coronavirus. CO stands for corona, 6 for virus, and D for disease. Formerly, this disease was referred to as 2019 novel coronavirus or 2019 nCoV. Symptoms. Most common symptoms: fever, dry cough, tiredness. Less common symptoms: aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin, or discoloration of fingers or toes. Serious symptoms: difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. Treatment. Self-care after exposure to someone who has COVID-19. Do the following. Call your healthcare provider or COVID-19 hotline to find out where and when to get a test. Cooperate with contact tracing procedures to stop the spread of the virus. If testing is not available, stay home and away from others for 14 days. While you are in quarantine, do not go to work, to school, or to public places. Ask someone to bring you supplies. Keep at least a 1-meter distance from others, even from your family members. Wear a medical mask to protect others, including if/when you need to seek medical care. Clean your hands frequently. Stay in a separate room from other family members, and if not possible, wear a medical mask. If you share a room, place beds at least 1 meter apart. Monitor yourself for any symptoms for 14 days. Call your healthcare provider immediately if you have any of these danger signs: difficulty breathing, loss of speech or mobility, confusion, or chest pain. Stay positive by keeping in touch with loved ones by phone or online, and by exercising at home. Effect on mental health. As the coronavirus pandemic rapidly sweeps across the world, it is inducing a considerable degree of fear, worry, and concern in the population at large and among certain groups in particular, such as older adults, care providers, and people with underlying health conditions. In public mental health terms, the main psychological impact to date is elevated rates of stress or anxiety. But as new measures and impacts are introduced, especially quarantine and its effects on many people's usual activities, routines, or livelihoods, levels of loneliness, depression, harmful alcohol and drug use, and self-harm or suicidal behavior are also expected to rise. Effect on Cooperate World. Overnight, many people have found themselves out of work and businesses do not have the staff needed to guarantee the same continuity of production and delivery of services to the public. Small and medium-sized enterprises, workers, and particularly the self-employed, were the first victims of a virus crisis that has spread from the health sector to the many different economic sectors in each state. Read more on the COVID-19 impact on SMEs. While the virus is said to be egalitarian, hitting everyone indiscriminately, regardless of their social or economic status, the social and economic inequalities, which already exist in our societies, mean that the crisis is having a particularly devastating impact on the most vulnerable members of society. By losing their job as a result of the lockdown, people who are already at risk of poverty are losing their main source of income and being denied access to essential goods and services. Women workers are faced with a dual burden. Not only do they represent 70% of the workforce in the healthcare system globally, Globally, they are now being forced to work longer shifts and to carry out additional work at home. The International Labour Organization, ILO, estimates a 6.7% loss of hours worked, which is equivalent to 230 million full-time workers, in the second quarter of the year due to the epidemic, and also expect global unemployment to increase considerably during 2020. The latter will depend mainly on future developments and policy measures, according to the ILO. Date March 2020. Present. Type global recession. Cause COVID-19 pandemic-induced market instability and lockdown. Total economic stimulus 29.87 Indian rupees lakh crore, 420 billion US dollars, 15% of national GDP, up till October 31st, 2020. Impact largest GDP contraction ever in Q2, April, June, FY 2020. 2021 at -24%, sharp rise in unemployment, stress on supply chains, decrease in government income, collapse of the tourism industry, collapse of the hospitality industry, reduced consumer activity, plunge in fuel consumption, rise in LPG sales, trade tensions with China. Cases 14.5 M1, 40,000 plus 235K plus 235,000. Recovered 12.7 M1, 27,000,000 plus 123K plus 1,23,000. Deaths 176K, 1,76,000 plus 1,341. Cases overview. Total cases 140 M14,00,00,000, recovered 79.5 M7,95,000,000, deaths 3 M. Vaccination. COVID-19 vaccines are safe, and getting vaccinated will help protect you against developing severe COVID-19 disease and dying from COVID-19. You may experience some mild side effects after getting vaccinated, which are signs that your body is building protection. No vaccine contains a complete form of the virus responsible for this illness. While their body builds immunity, it is normal for a person to experience minor side effects. The COVID-19 vaccine introduced in India will be as effective as any vaccine developed by other countries. Various phases of vaccine trials are undertaken to ensure its safety. Side effects. Reported side effects to COVID-19 vaccines have mostly been mild to moderate and short-lasting. They include fever, fatigue, headache, muscle pain, chills, diarrhea, pain at the injection site. The chances of any of these side effects following vaccination differ according to the specific COVID-19 vaccine. More serious or long-lasting side effects to vaccines are possible but extremely rare. Vaccines are continually monitored to detect rare adverse events.